Y'all see this live? Hello, everybody. I don't think we have anybody following yet. We're gonna talk. We're gonna get the other one set up here. Oh. Yeah, okay. But we might be. If anybody's watching, we have one person. Oh, two. We are seeing if we are upside down. All right. You want to introduce people?
Sure.
Or you will come work on that. Here, you can work on this. I'm not sure if Instagram's live. Hey everybody, for those who are watching us on Facebook, we are here to talk all things neck pain. We are 901 PT. We are physical therapists. My name is Dr. Clay Jones.
Dr. Jessica Oliveras.
And the lovely Dr. Sara Michael
Hi.
is figuring out the rest of this stuff. So we are sitting around during coronavirus 2020, right? COVID 2020. We're trying to, I think it's going.
I don't think so.
I'll look at it later when you introduce yourselves. Yeah, we're trying to figure out how can we be helpful as a clinic. We are still seeing some patients here, but we're doing a lot of telehealth visits. And so we want to still be helpful. We still want to be able to provide information to people during these times where you're stuck in your home, sitting on your butts, right? Still kind of doing the same thing you did yesterday. Tomorrow, Saturday, you're like, guess what? It's the same thing as today. So we want to still provide helpful information, and we're going to start doing this. We came with an awesome name, the 411, with the 411 with the 901.
In the 901.
In the 901. 411 in the 901. We have our beer because we're not seeing any more patients, right? So if you have a drink of your choice, we have some, it's happy hour. Oops, sorry, COVID, I don't want to touch your drink, my bad. So we're going to talk about neck pain. So if you have questions, if you have neck pain right now, if your husband, your wife, your daughter, your grandmother, your neighbor, if anybody has neck pain, oh, I see we have someone asking the question. I see what that says right there.
It's
Daniela, welcome. If you have neck pain and you have questions, please send them our way. This is our first one, if you cannot tell. And we're going to do this on Friday afternoons. We might find other times to do this, but we're going to do this on Friday afternoons and bring up certain topics that we treat all the time. Neck issues, back issues, shoulder pain with overhead lifting, waking up with a stiff back in the morning, arthritis in your knee, meniscus tear in the knee, plantar fasciitis. We're going to be talking about different things throughout the next few months, right? As long as we're all kind of hanging out, cooped up. So, we will be taking your questions if you have them. Again, send them in our way and we'll address them. If you want to hear something on a future topic that you yourself have, I'm sure we're going to have like 4 people watching this.
We've got 3 on Instagram.
We've got 3. So we can get very specific to you, to whoever that is. And I'm sure my mom's going to be one of them. So mom, if you're watching this, I love you. I will try not to curse. This is a non-alcoholic beer. And I'm just kidding.
Why are we talking about neck pain?
Why are we talking about neck pain?
Yeah.
We are talking about neck pain because we see it a lot. We see people with neck pain all the time, and particularly with everybody being at home, right? We're all doing this a lot more. Maybe you're even watching us on Facebook or Instagram Live here, and you're sitting there hunched over like this. And while you're watching us, you yourself are currently thinking, dang, this is kind of bugging me right now, right? So a lot of people, we've had several patients of ours call in and ask us these questions because a lot of people are sitting slouched over their phones. They're doing more sitting these days. Maybe you're working from home and your desk setup is a lot different. Maybe it sucks at work and maybe it sucks at home. And so yeah, we've been seeing a lot of neck pain lately. What have y'all been seeing?
Definitely seeing, I feel like my fair share of more neck patients right now, and I think that in part it's a stressful time. So I think, the neck is in the area that people are carrying stress, and so I think that we're starting to see, some issues there. And I think, again, people are tuned in, they're watching current events, and typically they're doing it on their phone or their screen. And I think that leads to much like my posture up until a few minutes ago, even as I was working on my iPad, of just being in a really forward head posture. And I think that that's contributing to a
Sarah,
lot
I
of
gotta
things.
interrupt you. My mom is watching. I'm not, like, I just knew it. My mom is watching. I love you. Yeah, so neck issues. Jessica, what type of neck, you've been seeing people with neck pain?
Yeah, I think to kind of piggyback on what Sarah was saying, a lot of people are, have increased stress right now.
Very much so.
Lots of extra time at home. Routines have changed. They're not in their normal habits and exercising and things like that. So that can definitely lead to some trouble in the neck area.
Yeah, and so the questions that we want to address, right, are why am I having this neck pain and how do I get rid of it? Right, those are the main things we want to help you with, is showing you, or talking you through some things that might help calm some of your fears down. Because a lot of people have neck pain, right? It's our spine. And if you have pain, particularly in the middle, right next to the spine, people get really concerned about what's going on with the anatomy. Am I having a disc issue? Is this a nerve pinch? Because we've had patients, right, who wake up and they can't move their neck, and it might be spreading into their arm or their shoulder, and they're really concerned about pinched nerves. I think that information or that diagnosis gets thrown around a whole lot. I've pinched a nerve. I've got this C7 disc bulge and it's pinched on my nerve and I can't move my neck because I got nerve pain, right? So we get that gets thrown around a lot. So we want to address that question or address that issue, since it's something we hear a lot. And yeah, teach you how to deal with it yourself. I myself, I've had, multiple car accidents. I've whiplash injuries from skiing. I used to headbang a lot. Many of my friends who are watching this went to ECS with me. I think I got in not like crazy headbanging. I was not a grunge person. Like,
How much headbanging were y'all doing at ECS?
I was just shoot me all night long would come on. I'd be like, shoot me all. Anyways, I would go to, we'd have some, we'd go dance anyways in college, Mississippi College, do it like a Choctaw. Yeah, and I would wake up with, all it says, I would wake up with neck stiffness. And so I've had my fair share of neck issues. So because of all those chronic things in the past, I wake up probably every couple times a year. It probably happens to me now. I used to get a lot more. I used to have a lot more headaches that used to go with that. And so these are things I've dealt with a lot, and we can, again, show you what we do as therapists to treat ourselves and how to help that. So any questions that have popped up? Anybody see any questions? I see all these. I got to pop in here. All right. Hello, Sue. Or Lori. What's up, Lori? What's up, Danielle? Okay. Sarah, you got anything else on that list that we need to, before we start jumping into it? Okay, let's talk about some of the basic anatomy, some of the muscles, and to help us with that, we're going to bring in our friend Dwight. All right.
Dwight is also COVID compliant.
Yep, I'm going to pull him off the. There we are. Bring Dwight around. Okay, there's the neck. I'm gonna show everybody here the basic anatomy. You can tell we've really planned this out well. Here's the back of the neck, right? So some basic anatomy. We have the skull. His skull's been dislocated. Hopefully yours is not. All right, but we have the skull. We have the first neck vertebrae. They call it cervical vertebrae, C1. There's 7 of them, so C2, C3, C4, C5, C6, C7. Then we have our thoracic spine, T1, T2, T3. So a lot of people are told when they have neck pain, or they go see a physician, maybe they've seen whoever takes x-rays, maybe a chiropractor. And so there's a lot of people who have had x-rays of their neck, and they're concerned about what those x-rays may show and what they may not show. And it's hard to show on the spine here, but in between each one of these bones, on the front side, let's turn them over. Boom. Again, his face should be there, but I'm going to turn it out of the way.
It's like the Exorcist skeleton.
Yeah, we have discs in between each one of those vertebrae, right? And so some people have neck arthritis, some people have, they're concerned about these little nerves that come out of the spine called pinch, and they might think, about the pinched nerve, right? So first things first, 7 cervical vertebrae. There's space in between each bone is the discs, and then again, the nerves come out to the sides. One of the common things that we see, again, I'm talking off screen here, is people are concerned if they've had arthritis. Like I had a patient of mine who came and saw me last week because he was having a lot of neck issues, and he sent me a copy of his x-rays, and it showed that the space between a few of these bones were smaller. It means the discs were a little bit smaller. Ugh.
And that happens. happens commonly. If you potentially had some irritation or potentially an injury to the disc in the past, a lot of times over time those spaces can decrease a little bit, and so that's a really common finding. And if you do have that on an x-ray or an MRI, it doesn't necessarily mean that that is the ultimate cause of your pain. It just might be something that is categorically there that appears on the image. It's kind of like having gray hair or wrinkles, right? It doesn't necessarily mean that that's my pain. It's just a product of my body adapting over time.
Yeah, and this guy, he had pain, his pain was in the lower part of his neck, and he also has, if he leans back for too long, can cause headaches. The spot where he had his degenerative discs, meaning the discs were a little bit smaller, was kind of in the middle, so between C3 and 4, and between C4 and C5. All right, and so his pain was lower than that, and his pain came above that, and so when I tested out the C3 and the C4 and the C5 nerves, they were fine. There was no problem. There was no numbness, no tingling. There was no muscle weakness. There was nothing in his presentation that showed me that he was having a nerve problem or stress to the discs of a C3-4 or the C4-5. And so again, we get a lot of people who come and see us who have x-rays showing a C4-5 disc is smaller, and they get told you have degenerative disc disease. That can be a really scary term. Again, like what Sara was saying, it just, a lot of times it's not like this active inflamed disc or this degenerating, it's about to fall and crumble. Like a lot of times people think, oh, my disc is just, it's going to hell in a handbasket. And they're really concerned about that. But like Sara was saying, a lot of times it's wrinkles on our skin, it's wrinkles on our spine. If you took an x-ray of my neck, I'm 38 years old, again with my histories of car accidents, whiplash injuries from skiing and headbanging, you're gonna find arthritis throughout my neck, okay? And I don't have, so my discs are smaller at a few different spots. I've never had an MRI in my neck, but if you took an MRI, you'd probably see that because the discs are a little bit smaller, there might be a little bit of pressure onto my nerves. I have no pain shooting into my arms. I have no numbness and tingling. So the point is, a lot of times you can have an x-ray show some problem with your discs, some arthritis and that kind of thing, but that doesn't mean that's the source of your pain. For this gentleman's pain, his tightness, the source of his pain was the fact that he actually had tightness above that spot at that C1, that first vertebrae, and below that, kind of that C7 where things were really tight. And so the muscles and the joints in that area were really tight, so that's what we were working on.
Likewise, if you do have symptoms that are going into the arm, that are shooting into the arm, numbness, tingling, weakness, that sort of thing, that is a little bit more of a sign of potentially some neural involvement, something kind of irritating that nerve. It's worthwhile getting that checked out, and you should get that checked out. It doesn't necessarily mean that, oh, that's going to have to go straight to a surgery or something like that. We treat neck pain all the time that travels into the arm that still has a little bit of that neural irritation, but again, kind of like Clay was saying, it has to do with the way that things are moving and our body's even chemical process of how it's all kind of working together. So if you do have symptoms like that, it is worthwhile to go ahead and get that checked out because we got to make sure it's not something worse. But the vast majority of it can be treated and can be treated well by just getting the system moving better. So
the symptoms that people should, so that's a great first question, right? If I'm having these symptoms, that needs to take me to my physician. What are those symptoms again? We can all kind of comment here. Like, what are those symptoms that people should ooh, if I'm having this, I need to talk to my physician. Now, first of all, because of the current COVID pandemic, if you have these symptoms, you're like, well, crap, I don't want to go to the hospital, or I don't want to, maybe I don't want to go to this clinic. If you're concerned, you have any questions at all, please call us. Our number is 901-310-3901. You can email me, clayj@901pt.com. But we want to help. We can help you answer those questions for you if you're concerned. But the question is, okay, if I'm having these particular symptoms, it's hey, I need to call my physician. If I'm having these particular symptoms, hey, call us. If I'm having these particular symptoms, here's some things you can do at home. If I'm having these particular symptoms, you're being a baby, you're overthinking it, you're fine. Just kidding. So what are those symptoms that someone should be concerned about that should take them to a physician? I'm thinking like trauma. I'm thinking like you've been in a car accident. Anybody watch the crazy car accidents that happened in, was it Hernando yesterday, North Mississippi. There was this cement truck that like was running through all these cars. So if you were one of those people and you got ran into and you have a car accident and you cannot move your head whatsoever, and I'm not talking like, oh, that hurts in like a couple of directions. I'm talking like, man, I cannot move my head. You have this impending sense of like real nervousness. Like I don't even want to cough, because if I cough, I feel like my head's gonna come off. That's a little exaggeration there. But not gonna touch my face. About to scratch my eye. Not gonna scratch my eye. But yeah, so like if you can't move your head and like you feel like I can't look down at all, or let's say you look down and you feel symptoms go into both arms.
Multiple limbs even, yeah.
Yeah,
arms or
multiple
legs.
arms and legs. Like you feel numbness into your legs. You feel tingling in your arms and your legs. You feel like there's all this numbness around your face. Like things that you're like, oh crap, that's different. Like that's the kind of stuff like you need to go to see a physician. You need to go get an x-ray. Heck, if you can't move your neck and you've been in trauma, you need to call 911. You can call me like, hey Clay, I'm stuck in a car, I can't move my neck, what should I do? I can't feel my arms and legs. I'm like, hang up, call 911, right? So so be safe about it. But so that's like trauma. Let's say you're working at your home and during this crazy time, you're like, hey, I'm gonna get some stuff done around the home, and you fall off your ladder and you get up and you can't move and you feel these symptoms. You need to get an x-ray, you need to call 911. But let's say it's not that terrible. Like that's worst case scenario.
Probably true numbness, like
Yeah.
when you feel your arm, like a lot of times we can have neural irritation that feels like it's kind of tingling, or like the arm is kind of going to sleep, but you can still feel it. Like if you brush in that area, you can still feel that there's contact there. But a more significant numbness where you touch it and you can't recognize that you're touching that area at all, that's a potential marker for something a little bit more of a significant neural compromise.
Or you go to pick up the Lysol can, and you're like, oh, and it drops, and you're like, I can't do it, because like you're all of a sudden having a lot of weakness in your hand. That could be a sign that you're having the nerve is under stress, and the nerve which supplies, let's say it's coming out of C6, C7, and that nerve that supplies power to your muscles in your hand, you can't use your hand all of a sudden, or that's starting to get a lot worse. That's the thing where you might say, hey, call your physician, you might need to get that checked out. With that said, we have people that will have a sprain to the discs in their neck, causing some swelling. Just like think of like if you sprained your ankle and the ligaments get really swollen and bruisey. You can sprain your neck from maybe too much head banging, or maybe it was a car accident. You wake up the next day and you're like, ooh, this is really painful, and now I'm feeling this tingling into my hand. Do know that is something that we as physical therapists, we treat that very well, and we treat that and we assess that all the time. Where I had a patient a couple months ago who had this and was having some of that weakness and tingling. It wasn't terrible to where he was nonstop, couldn't get out of it and couldn't feel anything. It was moderate where he was starting to feel weakness in his hand, like he was trying to pick up a coffee cup, and you could tell that was getting difficult. And he had pain that was going to his arm. We as physical therapists, that's stuff that we can help treat. We can show you which movements can be done to help calm down that swelling and irritation in your neck. And if it's the kind of thing that it's not calming down, and we find your reflexes are off, or you do have numbness that's staying around, we're going to call the physician for you and say, hey, this is something that we normally treat, but this is something that is not clearing up with what we typically do. So we're going to call that physician and have that discussion with him or her about that's when we might need an MRI. So those are kind of, and there's a lot more to that. Of course, we're not trying to get too detailed here, but let's talk about more of the common stuff where people come to us and they're really concerned. They need an MRI because they're having pain. They feel like they need an X-ray. Let's talk about why they don't need that MRI. Maybe they don't need that X-ray as much, or what if they have an X-ray showing again. We already talked about some, but like what is a disc bulge? What are some classic symptoms of disc bulge? What is it not? What is a classic symptom of a nerve pinch versus what we typically see? We're like, no, your nerve's fine. Like what would you see, Jessica, if someone's having like a nerve pinch? Like what is that really going to look like?
They're going to have pain moving backwards usually.
Yep. What do you mean by that?
Looking up or extending the spine. They might have something going down one side of the body versus both sides.
Yeah, good point. Yeah, so like if you're looking up and you get this shooting pain into your arm, then And we're talking about shooting pain. Like if it's a nerve pain, yeah, it's going to be kind of specific. It's not going to be like, well, I've kind of got this pain in my arm, or it's like you go look and you're like, I'm not going to do that because it shoots into your arm. And it may be looking up, it may be looking down. You go to do that and you get this shooting pain into your arm. Maybe coughing. If you cough, you sneeze, and you feel like, oh, and it really shoots into your arm. And maybe you're holding your head like this. I've had a few people who have nerve pain. Yep, they do that because they know that when their arm hangs down by their side, it's like this constant pain like that. And so they might. So if you do this, if you're watching us doing this, you might have some nerve issues. So that can be some things that are causing where the nerve is under stress. Again, we've already talked about numbness, tingling. So those are things that can be causes of nerve pain. If someone's coming, so let's say we have someone here watching this, and they feel like they have that kind of pain into their arm. What is maybe something they can try at home to see if they can do a few movements to help that out? And again, this is on a big spectrum. Someone might be in a lot of pain versus moderate pain versus milder pain. So if you're having a lot of pain, please don't take this as like medical advice and say, oh, well, they said do this. And I mean, if you have really concerns, call us first before you try this. But if someone's having, I've kind of had this in the past, it bothers me every now and then, it goes into an arm, what are some things you might recommend?
A lot of times, for me in particular, I've had a lot of just little ongoing kind of neck issues that have accumulated over time.
From headbanging?
Yes, totally from headbanging.
I'm gonna wake up tomorrow with a sore neck. Oh, shoot.
But I will say, generally one move I'll start with is just assessing how it is when you work on just pulling the chin straight back. So a lot of times when people pull the chin straight back, they either have a tendency to look down and flex the neck with it, and or they'll kind of go back up into extension, as opposed to being able to just draw straight back just like that. So, because we think posturally, right? So again, with all of us on our phones.
Like someone blowing onions in your face, and you go, ooh.
COVID.
Yeah, if you think someone's coughing, you get COVID. Like, oh, you know,
dodge the germs.
It's a straight retraction.
So when you're in bad posture, right, and the head comes forward, basically what happens is this lower spot in the neck kind of stays flexed, it stays arched. And then back up here, up in the back of the neck, up real high towards the skull, it gets real tight. This can also be a real common spot to start generating headaches. So if you've got pain that travels up behind the ear,
I don't want to stay here very long.
yeah. So if you have tightness a lot of times there, it can refer into headaches. But basically when we go into this retraction, it takes us out of that poor posture. So it pulls that lower part of the neck into extension, and it allows the upper part of the neck to stretch out there a little bit. So it's a really good place to start by just trying to pull that chin straight back into that retraction.
And what we expect there is if someone's coming to see us and they have this pain that comes in this area, and again, they might have, like when they look up, that pain might go into their arm. If you look down, that pain might go into your arm. If you turn to your right, whatever, just any type of movement. This is one of the first things that we'll try. We want to see if your neck, we'll call it directional preference. Is there a preference to a certain motion? So like if let's say, if the more you look down, man, the more I go, that's actually making things worse. I'm feeling it more in my arm, Ooh, stop. So we have a lot of people who feel like, oh, I've got this pain in my neck, it goes in my arm, they're sitting here trying to stretch it out and stretch these things out. Because the stretches they might have found online, and that's just pissing it off. You don't want to keep doing that. So this is one of our first movements we'll try, and we'll see how it feels. And if you're having a decent amount of neck problems, like when you first do it, it's not going to feel great. You're not going to be like, oh, it feels so good, it's relieving. No, you're going to feel like, ooh, it feels tight back here. You might even feel like, oh, I feel it go into my shoulder. That's fine. We're safe to proceed. The more that we do, I'm going to keep going, just like this. And if maybe I get to 6 or 7, the more I do, I start to feel like, yeah, I don't feel it there as much. I start to feel it up here. Winner, winner, chicken dinner. Boom, that's exactly what I want to do, right? So that's what we call your symptoms are centralizing, or they're coming back to the middle, to the central spot. And so we will keep up those repetitions, doing 10 to 15 repetitions. We give it a break. We do it again. And that's if you're having mild, moderate symptoms, this is something that I would try. Again, what's going to help you be safe and know that this is okay to do? Because this is not a willy-nilly, let me just do what they say and just grip it and rip it. No, you want to kind of see how it goes. And the way you know you're safe and that this is going to be therapeutic, or movement is medicine, this is going to be medicine for you, is the more you do, the better this feels here. You might feel a soreness and stiffness in your neck, but if this is getting better, then you know that's what you want to keep doing, right? So this is for people who are having that disc type pain, that maybe there is some nerve stuff going on causing in the arm. And I'll be honest with you, this is not very common. This is not like the most common thing we see when it comes to neck issues. So we have a lot of people who come and see us who had an x-ray or an MRI and say, oh, you've got a disc bulge. And most of the people that we see and talk to, like the disc bulge, even though they've been told they have a disc bulge, they don't have these classic disc bulge type symptoms. Maybe, again, their disc has been injured in the past. Maybe they have some degenerative changes, some arthritis. But that doesn't mean, just because it shows up on an x-ray or an MRI, doesn't mean that's what's causing your pain. Other things can be causing that kind of pain.
But
FYI.
I think what you were saying is good, that, you know, a big key in self-managing something, if you're assessing it. So when I get these little tweaks in my neck, right, as I am kind of starting to move and I might have a little bit of pain with it, one thing that I'm going to look at is like Clay said, like, how does it do with repetition? If something is hurting, you do not want to be aggressive. You do not want to crank into it.
Right.
It's a really, especially in the neck, that's a really quick way to make something more angry. But you can kind of approach that motion and just repeat that process. You know, pain, it gets back to what pain actually is, right? Pain is a communication from your body and to your brain, right? And vice versa. So really what we've got to do is we've got to listen to that communication and say, what happens the more that I'm doing? Is it getting better? Is it getting worse? If it's getting worse, stop, right? Absolutely stop. You know, it's one of those things.
But you got to test it out first,
but
right?
you can't just feel it and say, oh, pain, and run away from it.
Right. A lot of people come and see us, it makes sense. They're scared of that pain they're feeling. It's like, hey, it's my spine. I'm feeling something funky with this. And they're like, if I keep moving, am I going to pinch a nerve and now I'm going to crap myself because I hurt my spinal cord, or my tongue's going to go numb? You know, some people, we can go crazy. You can let your head spin out. But I think it's a good point Sarah makes is, if you have pain, test it out. And if the more you do, the worse it gets. Boom, your body's telling you stop. So that's good kind of lead into a more common scenario that we see, which are more people here. We're going to talk about called the acute wry neck or crick in the neck. So we'll talk about that right now, and then after that we're going to talk about kind of that constant dull shoulder pain. You always need someone to rub that spot out. So that's what's coming up if you have questions about that. But let's talk about, you wake up, maybe you're not having shooting pain in your arm, but you wake up and you're like, man, I can't turn my head or look up or look down. Kind of what might be going on with we call the pathomechanics, what's the problem going on there, and how what we just talked about applies to that. What would you say, Sarah, if someone wakes up and you're explaining to them, hey, I've got my neck, I woke up and I can't move my neck very well?
Yeah, so I mean that most often kind of comes with a little joint irritation, right? So, you know, over here on Dwight.
I got it.
Don't worry, Dwight's coming.
Oh, I got it. It's fine.
So we have joints that connect each of our vertebrae, and so the joint itself can get irritated as well. So a lot of times this will be, you roll over at night and okay, you get a little pain in there.
This will have been a lot easier the first time I was supposed to pull into Dwight, and I'm an idiot.
So here,
right, so yeah, go ahead, Sarah.
So here are the joints basically that connect each of the vertebrae. So the vertebrae are stacked on top of each other, and what's interesting here is that these joints, obviously they move. So as I go into extension, the joints kind of come together, and as I go into flexion, they'll kind of separate apart. Same thing with rotation. The joints will move, and that's why with this, particular movements will be more or less painful. And so a lot of times, any type of rotations, a lot of times this will be where you turn your head to the side, or you're trying to check your blind spot, and you get that, and you get a little acute little zap or pinch. A lot of times that'll be part of that joint irritation.
Yeah, let me show that motion right there between this bone and that bone, that bone and that bone. You can see when the vertebrae turns, you'll see a little bit of sliding back and forth right there. Those of you on Instagram. Right, so it's sliding back and forth. That's that facet joint that Sarah's talking about. When you turn your head, you might feel that pain and pinch. that joint right there could be what's stiff, gotten kind of tightened, grabbed. And it's not just the joint, but also then the muscles that attach to it.
Right, and so typically
So it's
what
not
will
just the
happen,
one thing.
you know, is that you're really getting pain towards your end of ranges, right? So, you know, you might be able to move okay, you know, in this little early bit, but then once you turn all the way, and or you look back, like you're trying to reach back over, reach back for something behind you, that might be where you have a little bit more irritation through there. And the muscles definitely guard and they'll spasm and they can contribute to a lot of pain there as well.
Yeah, for me, when I wake up, it's typically, sorry, I'm keep changing this thing here. I want to get our Lysol decoration. For me, when I wake up, like, Sarah's talking about end ranges. When I first wake up with this pain, my end range is like there. Like, there's no way I'm getting to full motion. But it's, when I go in that position, it's like it'll pinch right there. And a lot of times when I first wake up, or I've done something the night before, like last time this happened, this might have been last summer. I think I had my son on my shoulders and we were spinning in the pool, and I was an idiot, put my hands out and spun like that, and his knees went, and I was like, oh. No, I know what it was. The last time actually I was trying to do a handstand, these handstand push-ups that I cannot do, and I freak out anytime I go inverted. I came crashing on my head. I was stupid. But it started getting tight, so I knew that like the rest of that day, I'm like, all right, I know what's gonna happen. I'm gonna wake up tomorrow morning and not move my head. So I wake up, and it's really hard to lift my head out of the bed, and that's where a lot of people get scared. It was like, I can't even lift my head. I can't like get up off the pillow, which again, people are scared. If I'm about to bulge something or pinch something, it's just your muscles go into this really strong protective pattern. And so then when you sit up, you're like, oh crap, I can't turn at all. I can't look up at all. And that's about it. Usually going that direction won't be quite as bad. But it's that motion, it's that joint that has been sprained. Just again, think of like you can twist an ankle, and you get that maybe a little swelling, a little maybe inflammation in there, and then the muscles around it grab as well, because your body's trying to protect it. So when that happens, if you've had that happen, what do we do about it? What's the first step? For me, the first step, if I have that, I say, okay, don't get scared. This is not a nerve pinch. I check. I'm like, okay, I can still move my arm. This is doing fine. I'm not having any shooting pain. Okay, this is just kind of a sprain here. First thing is I'm going to rest this. I'm not going to sit there, and as Sarah said, just like keep pushing and keep pushing. Oh, I'm going to just try to stretch this out. If you sprained your ankle, if you rolled your ankle and you woke up the next day or maybe a few hours later, it's nice and swollen and you can't move it, you're not going to try to sit there and like wrench on the ankle. Right? You're going to be like, hey, let's rest it. With a little rest, ice, compression, elevation. Right? It's all things to kind of help create a nice healing environment for that sprained ankle, but we know it's going to clear up soon. For the neck, I'm going to rest it. I'm not like, to me, when this happened, I didn't go to my workout the next day and start doing a whole lot of weights pressing overhead. I didn't do, I skipped the sit-ups. If they were burpees, I wouldn't have done them. Thank goodness. I hate burpees. I would not have done a whole lot of strenuous thing because I want to allow my neck and the muscles that attach my neck just to chill for like 24 hours, maybe 48 hours. Like, I'm going to be nice to this. You can put some ice back there. I think that ice or heat, I don't think either one is drastically better than the others in my experience.
Typically when people, that's a good thing. People ask me that all the time, like ice or heat, ice or heat. Barring something like acute, like you sprain your ankle and that is red and hot and that sort of thing, for the most part, I say whatever feels better, right? Yeah. So if you get more relief with heat, use heat. If you get more relief with ice, use ice. Alternate in between, right? A little bit of contrast can be good. So, that's just a common question I get.
Right, so ice or heat, because a lot of people hate ice, they love heat. So go sit there in the shower and just use all the hot water and just let it, work on that neck and let it, help it kind of relax and things. So I'm going to do rest, ice or heat. Compression, don't compress your neck, right? Don't take an ace wrap, like, well, they said put compression in it. Don't do that. The compression and elevation, well, guess what, my head's already elevated, so, don't do that. So the point here is I'm going to rest it, I'm going to use ice or heat, but I'm not going to try to do aggressive stretching. Most of the time, like if you came and saw me and this happened, I'm not going to sit there and grab your neck and try to yank it around to loosen up those tight joints or muscles. If it's been lasting for a while and it's staying sore and it's not moving, we might need to get in there and get some things moving with the joints and the muscles. But first thing is we need to be respectful of the body's healing process. Again, think of it like an ankle sprain. I always use this as an example because everybody knows if you sprain your ankle, you're not going to sit there and just jam on it. You want to kind of let the body do its thing and let it calm down and heal. Other things that I would do if this gets really tight is if it's making you anxious or really nervous, breathing, good, called diaphragmatic breathing, can be really, really helpful, as opposed to short chest breathing. I'm trying to breathe through my diaphragm and get that moving. You can't see my belly here. So I'm going to try to focus on that day. I'm just doing some diaphragmatic breathing, some yoga breathing, if you will, to help kind of, because if this is tight and sore and those joints and the muscles around it, if I'm a real chest breather, and every time I breathe in, I'm using those muscles, that's just going to make it kind of worse and take it off.
And I will say, typically, again, when I've had, even just speaking from personal experience, when I've had pain that woke me up at night, and that I couldn't, typically it's neck pain. For me, it's on my left side. And it's really irritating, especially as a physical therapist, and thinking like you should know everything to do to make this better, and I'll try everything I know to do, and it still hurts. And I'm irritated, and then it's honestly worse
And she's
because
irritable the next day at work.
Yes, totally.
Just kidding. She's lovely always.
Always. So I ultimately have found that the best thing that allows me to relax is deep breathing, because there's multiple things that are going on there. One, I'm actually giving my muscles here a good stretch, right? All of these muscles that are in the front of the neck, they're going to attach to those upper ribs. So when I take nice deep breaths, you get a little bit of a mobilization through there. And it helps to relax things. It helps to relax your brain, especially in the middle of the night when then now you're mad because you're woken up and you're in pain. It can relax you and just be just enough just to help you kind of drift back into sleep. So I think that that's a really big key.
Another thing is don't slouch or put yourself in bad position for a long period of time. That's probably the better way to say it. Because most people are like, when I have this, it's impossible to slouch.
Yeah.
I'm not slouching. I'm looking good.
Yeah. You're never slouching. You're
That's
perfect.
right. But, I mean, I know this happens. If I try to slouch, he goes, I can do that. And so, I'll do this. My wife will ask me in the morning, what's going on with you? I'm like, yeah, I know, it's my neck thing. And so, you're not going to slouch. But what is going to tick this off and make it worse is if you stay in one position for too long. So if I worked in front of a desk, if I sat there in front of my computer and tried to be there the whole time, just though that one sustained posture can lead to this staying aggravated. So best thing, if you're sitting a lot, is to put a timer on your watch, put a timer on your phone, your computer, whatever it is. Put a sticky note on your computer pad says stand up, stupid. Don't be an idiot, stand up. And get up and walk around maybe every 30 minutes. So put a timer on your watch, 30 minutes, and just move around. Motion is lotion, movement is medicine. You'll hear us say that a lot. So I'll walk around, then I'll come back down and sit and work on a computer. If I'm on my phone, I make sure don't be tilted like this. And I'm going to go for a walk. If things are irritated, go for a walk. If you love to exercise, you're fine and safe to exercise, but make it easy. Don't do a strenuous arm stuff or overhead stuff. Don't do strenuous squats if it's a leg day. Just go easy. But getting other things moving can be helpful by doing some simple rows, doing different standing yoga positions, yoga movements. That's fine. Just try to keep things a little more calm down. But movement, in other words, can be helpful to get you past that. So then, okay, you've done that. Typically for me, it's a day or two. Medication, BT-Dove, as a physical therapist, it's not in our scope to prescribe medicine. So for me, I will take some over-the-counter anti-inflammatories. I don't have any other issues, medical conditions that doesn't allow me to take anti-inflammatories. Some people have those, so don't do that if you do. But I'll take some anti-inflammatories for myself if I feel like I need to, or just some light pain, some Tylenol or something like that, just to help kind of calm things down. I don't always do it; it just kind of depends how irritated it is. But that can be helpful. But this is definitely not something like, oh, I'm having pain, I gotta go rush to get a steroid dose back, or I have to go rush to get some type of hydrocodone, some strong pain medicine. Again, a lot of people do that because they're scared, they're not sure what's going on, and so they're scared of that pain, which I totally get. But this thing will work through, and I want you to really think of that phrase, movement is medicine. It actually can help. But try this deep breathing and relaxation like that. So after a couple of days, after about probably day 2, day 3, is when I start really trying to work on my motion. And this comes back to what we said earlier, is start testing the waters. Again, think of an ankle sprain. You're not going to sit there best practice is you do not want to, like, if you sprain your ankle, don't go put it in a boot for 6 weeks and leave it in a boot nonstop and not ever moving it. There's a time for a boot, that's another story. But I don't want you to say, oh, I hurt my neck, don't move my neck for the next week. That's a bad idea. That's what's gonna make it stay around and prolong that pain that you're having. I've evaluated someone 2 weeks after them waking up and having neck pain, they still have not really moved their neck because they're scared, they don't know what's going on. So if you're having this, know that it's most likely a joint or a muscle, and maybe like the fascia is involved with that kind of thing. And so you want to start testing that motion out. So again, like how would, Sarah, you would guide someone through, how would you, advise them to?
Yeah, so typically when, a lot of times, this is where you'll start to kind of work into whatever motion is limited. So, and I think that this is where, starting to move the head, but starting to move the head in ranges that's not painful at first is key, right? So you can just start to work, if I have pain when I turn my head to the left, maybe I just work on just a little rotation through there. I'm not cranking my head as far, and then I can start, once I've done that, 10, 15 times, maybe I start to work myself a little bit further. All right, I start to feel a little bit of a pain, I back off. Sometimes this, one thing that can be really helpful is just little isometric contractions here. So just allowing the muscles here that are deep in the neck to kind of turn on a little bit. Again, this is something that is not aggressive. It's a light, gentle little push. So I might turn to the left, and just before I even get to a point of pain where I'm just going to put my hand to my head, not on my face, and then I block. And I'm basically turning my head into my hand.
So she's trying to twist her head that direction. She's just blocking it.
And so basically the muscles on the left side of my neck are going to turn on a little bit. And then I'm going to let it relax. And I'm just going to try to maybe take a few deep breaths there. And then maybe see if I can go a little bit further. And a lot of times if you get that, if you can turn that muscle on a little bit, then it's gonna immediately relax, and it might give you a little bit further motion kind of when you start to move into that range.
And like she said, you want to start working on emotions. So in this case, if turning to your left was causing pain, I'll work on it just like she said, and then I'll test out the other motions. Going to the right, I can go further. Well, I'm going to go to the right. If I feel a little bit of stretch but not that bad of pain, well, I can work on that motion. And just by getting my muscles and joints moving in this direction can help get the ball rolling to help it go back that direction. Same thing with looking up, looking down. What I find helpful for me is I hold on to my neck, because if I look up, like, that feels, it just doesn't feel good. It makes me nervous. And so I will hold on to my neck. And when I do that, I can actually go further, and I'll feel that pain on that side. Let's say it's on this side right here. I'll feel it, I'll just kind of touch into it, and I back off. We call it, you want to kind of poke the bear. You don't want to punch the bear. So you just kind of poke into it a little bit and come back out of it. Breathe. Because I know that if I hold my breath when I'm doing this and I'm going, is it going to hurt? 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 Like, that'll make it worse. So breathe and relax into that. And I'll check that motions. I might hold my head and go down and just kind of ease into those motions. And that usually for me takes anywhere from like day 2 of this kind of thing, maybe day 3, all the way to about day 5, day 6, to where by then I'm like, yeah, okay, I'm moving pretty good. I've gotten back to most of my activities now. I'm like, well, yeah, I still feel a little bit there, but that's how I kind of get there. All right. Now, once you're there, this is where I think a lot of people get stuck at. And if you have this constant pain right through here that we're about to talk about, you might have had these experiences of like this neck kind of locking up on you. It happens once a month, once every few months. And maybe the problem is you never worked on getting back full motion. You have not taken the medicine of movement. Movement is what you need. So full motion. I've got a patient who has headaches, and lots of headaches that come around, right? And he let me know, by the way, that, I'm sorry, it was a lady that I saw a few months ago, that she let me know that, yeah, she gets one of these kind of neck lockups, these necks, crick in the neck, every couple of weeks. And when when we were looking at her emotions, when I was interviewing her that first visit, I was like, that's part of our problem, is that you have gotten this for so long, you don't realize that your emotion is here now, where it should be all the way back there. You don't realize that you only turned to 60 degrees where she needed 80 degrees. So because
that barrier's happening sooner and sooner every time.
So every time she wakes up that neck, now it's just getting stiffer, stiffer, and stiffer, and stiffer, and stiffer. And then she gets an x-ray and says, oh, you got some arthritis in your neck. She's, oh crap, that's my lot in life. I've got degenerative discs. And that's what's causing my headaches. No, BS to that, right? It's the fact that she didn't restore that full motion from these repetitive little injuries. And so what we have to do is go after those motions. For me, I know that if I don't go after those full motions, because of my old history, I used to have lots of chronic neck pain and headaches. And I know that if I don't get after that stuff, give me about 1 week, and my headaches are going to start coming back. And so I have to really make sure I get back full motion. So by day 6, day 7, I'm starting to really work on full motion. Full motion. And then I start working on the side-to-side stuff, right? And that's just another little caveat for this. If you wake up this pain, my experience has been, it is not helpful, like if you have this pain here, it's not helpful to just pull to the side. I find that it's a little better if you start off with rotations first, and looking up and looking down, and as that starts to clear, then start working on your side-to-side motions. But that's still something I'm going to work on getting back, because I know that I need full motion, going to my left and tilting back, going straight back, turning to my right. I start working on clearing all of these corners and spots of my neck motion, because if you don't, you can likely potentially end up with some chronic neck issues. So if that's you, and you have this chronic neck issue, your first thing is, what is my motion like? Can I turn to my right as far as I can go to my left? Can I look all the way down, chin to your chest? You should be able to tuck your chin to your chest. So for whoever's watching this right now, check yourself. Check yourself before you wreck yourself. Right? Can you put your chin? You're like, oh crap, I can't do that. Are you a couple of finger widths away? Right? That's a problem. That is a source or a common problem that can cause that neck pain, and that has to be addressed before any dang injection or surgery or whatever medication is going to fix this. You can inject this all you want to. If it's not changing your pain or it feels good for a while and it comes right back, maybe it's because you have not restored full motions, and that's got to be key.
Particularly when we talk about the
And
spine.
I'm going to grab something to demonstrate it. Go ahead.
Particularly when we talk about the spine, you know, a big thing that we focus on there is a lot of the inert structure, the bone, the joint, the nerve, the ligament, the disc, and you're leaving out the muscle, right? Our spine is controlled by muscles. It's supported by muscles, and a lot of times, you know, when it's easy to see it, if you've ever had a surgery or if you've ever had an injury, a response to pain, a muscular response to pain is weakness, right? It's a physiological response. The muscle gets inhibited by pain. So when we have this pain, the muscles around that area are going to become a little bit more inhibited. So part of this is training the muscles. It's about strengthening the muscles and getting back to full motion.
Yes. One way to help get your muscles in that full motion, this is just a flexibility exercise. I'm going to go through this quick. I think we posted a video about this on our Instagram and Facebook pages like this past week. But if it's not, you'll find it, go back in the history, and it shows this exercise called snags. And this is what I usually get and do about day 6, day 7 if I need the help. And I'm going to use this towel, or this pillowcase. Pillowcases work great for this, better than a towel. I'm going to put this right below my ears. And I might test it out there. I might test it out a little bit lower. I'm going to try to figure out where is the best spot. And I'm going to start by pulling forward, straight forwards. And I'm going to keep that pull while I look up. So if you look up and it causes that pain, so let's talk about those people again who may have that chronic spot that just can't get massaged out, right? This can be a very helpful technique that if you look up and you feel your spot right there, or you turn and you feel that chronic spot right there of tightness in the muscles, the joints, whatever it may be, this is a great treatment for you, self-treatment. So I pull forwards and I look up. And if I'm at the right spot, I should be like, oh, what do you know? That doesn't hurt the same way. Maybe I feel a little bit, but it should be like noticeably different. Not like, it helps a little bit. No. If this technique is right for you, you should be able to look up and be like, oh, that definitely feels definitely better. If you try it and it doesn't change it at all, move the pillowcase down a little bit and re-go. You might be like, oh, that feels better. Or you might do it, you're like, oh, no, crap, that makes it worse. Okay, come up a little bit higher. You just have to play around with different spots to find out what works better. That's for looking up. For looking to the side, if I'm going to turn in that direction, I'm going to put this down. Here's the tricky part. Cross the arm over, pull this down right here. So I'm pulling down here, and I'm pulling this one that direction towards you. And I'll pull and I turn. And I'm not cranking on this, but I'm giving a good little tug. But it should be the same experience of if that hurts, let's call it a 5 out of 10 pain. That should be like, oh, that's like a 1 out of 10 pain, or maybe 0 out of 10 pain. It's like, no, that doesn't really help it. Take the pillowcase, move it up a little bit higher, try the same thing. But you're trying to find a spot where like, ooh, that feels better. If that feels better, you want to go 5 repetitions, give it a break, another set of 5, give it a break, another set of 5. I do 3 sets of 5, and I'll do that 3-4 times a day to try to help clear that motion. Cool? All right. Let's finish, which this is getting long. We start talking like anatomy. I'm like, crap, it's been 50 minutes. Dang. I'll say like 20 minutes, not when I'm talking. Paul, if you've handled this long, God bless you. So, if you're having this air tightness and chronic neck pain, these are some specific things we've talked about. Let's talk about lastly, let's talk about what are some other things people can be doing if they have this pain that's been there for a while, it's not going away, it kind of keeps coming back. What are things they can do around the area with their shoulder blades, their thoracic spine, or their mid-back? What are some postural-based, movement-based exercises that y'all, like your go-tos, your favorite things to recommend if someone's got this kind of neck pain here, maybe in their shoulder blade, that kind of stuff?
I definitely like working on the thoracic spine.
How so?
Introducing either some foam rolling, a foam roller, or using like a thoracic rotation in kneeling to kind of take out the lumbar spine.
Yeah, this is the thoracic spine. We talk about the cervical, the first 7 vertebrae. The thoracic is anything that the ribs are attached to, T1 down to T10. So why the thoracic spine? Like what about the thoracic spine? Why do you think it gets stiff? Why are we in those positions?
Everybody's on their phones, and they're all sitting, we're all sitting at our desks, we're all here, we're hunched forward, and so we don't get good extension, and really we're not in those postures very much that even demand that motion out of us, so
Yeah.
I think that area gets stiff and weak.
Yeah, and the exercise that Jessica recommended, the foam rolling, yeah, it's working on foam rolling, taking you towards extension. When we get stiff this way, we start losing our rotation, so yeah. Rotation-based thoracic stretching, there's a ton of them out there. Again, Jessica mentioned a few that we have on our page where you're on your kneeling and you do some assisted rotations. It's very,
Use the wall for assistance also.
yeah, using the wall. There's so many things you can do. But if you have chronic neck issues and you've never gone after flexibility of your mid-back, your thoracic spine, that's key. If you're doing yoga, we see people who have this and they're doing yoga, hey, I'm working on flexibility. Still, we have a lot of people who do that, who have yoga practice, that when they go to twist, they have such flexible lower backs or maybe hips, that when they twist through here a lot in their lower back, and they're not twisting through their mid-back. So you can still have stiffness in your mid-back, or when they go into, as part of their chaturanga, and they might go into this like cobra type position. It's all lower back. They're moving a lot in their lower back, and they're not really opening up through the mid-back. So the point is, focus on how you're moving, between here and here for your mid-thoracic spine. Sarah, what about the shoulder blades, scapula?
I think, there's probably 100 different strengthening exercises that you can do, but I do think that this is where just general strength in the shoulder blades, and even kind of through our rotator cuff. So just a good just postural correction. And you're sitting at your desk and sitting up nice and tall, and then working on basically keeping my elbows tight into my body, not letting them come out like that, but keeping my elbows tight and pulling my wrist out. So when I'm doing that, ultimately I'm squeezing my shoulder blades together.
As opposed to showing when you don't squeeze your shoulder blades. If that's your wrist going out and your shoulder blades are not squeezing back there, so do it correctly. Good. So you should be feeling this back between the shoulder blades.
Right. So just something that you can do just a lot throughout the day that just might help you stay a little bit looser. But ultimately, if you've gotten weak in there, it can take a lot of training to kind of get that back in
Yeah.
gear. But But I think that that's just a good place to start.
Yeah, and for strengthening, yes, strengthening the posterior chain, strengthening the shoulder blades, strengthening your shoulders. That's where here at 901 PT, we're a big fan of lifting some weights. We all enjoy lifting weights. We love using the barbell, we love kettlebell work, different things to work on building strength in your postural muscles of your shoulder blade, even chest, just everything. Like if you've had chronic neck issues and you've never done any thoracic spine flexibility things, if you've never done some actual strengthening of your shoulder blades, not just stretching, if you've never done some real good strengthening of these muscles, then you're missing out. If you look at research studies and you look at chronic neck issues, you look at chronic back issues, people who do the best are those who are moving and exercising more so than having anything else, pain medicine, whatever it is, it's moving, it's exercises. So adding some flexibility, mobility, this is where you might be seeing someone like us, like a physical therapist who can help. We do manual physical therapy where we do a lot of muscle work like dry needling, myofascial release. Maybe you see a massage therapist or a chiropractor, just some type of therapist who's helping you getting your spine moving, not just this one spot, but getting the rest of your spine moving, and you follow that up with good strengthening exercises. It's so key. So let's end on that. Yeah, the message here, y'all, if you have chronic neck issues, our little tagline is we want to help people recover from injury and get back to what they love without relying on medications, injections, or surgery. So if you've been relying on an injection every 6 months or 3 months, or a surgery, maybe that didn't quite do the trick. If you just have medication that you're relying on, if you're doing that stuff and you're still having neck pain, y'all, there's so much more going on. It's not just about disc bulges and nerve pinches. It's about how is your body moving. Movement is medicine, motion is lotion. You need to work on exercises that get full motion of your neck. Like that's a take-home message I want you to think. Do I have full motion of my neck? And if I don't, how do I do that? How do I get at that? If I'm seeing a physical therapist, a massage therapist, a chiropractor, a rolfer, a body worker, whatever it is, make sure that includes you getting that full motion, not just come in, see me, let me dry needle it once and send you out the door without giving you something to do to work on full motion. You have to work on getting full motion back. So get that back. 2, get everything else around it moving. Get that thoracic spine moving. Get your shoulder blades moving. Right? 3, get strong. Having strength is so helpful for these things. So if you have questions about that, Jessica, Clay, Sarah, we have another therapist starting with us, Dr. Jonathan on Monday, Dr. Lawrence, another therapist that works with us as well. We are all here to help answer questions. Y'all, we're sitting around on Friday afternoon drinking beer, having some champagne. We are here to help. So if you have questions, please reach out to us. We have the time to do that. We would love to be a resource for you guys because we know that, heck, if this is something you're concerned or scared about, that we might typically take you to your physician's office or typically get you out the door to maybe even go to the hospital, call us. We can be a resource to help you guide you through that decision-making process. We would love to do that. All right, next week, next Friday, right around similar time, 3, 4 o'clock, we are going to pick another topic. It will likely probably be back issues or shoulder issues, and be staying in touch with our social media pages here, and we'll tell you more about that. But we'll be doing the same thing, so if you have questions about that, please let us know. Can't stop. Kevin, you're doing your thoracic stretches now.
Yeah.
You are a beast. Well done. You're awesome. All right, guys, thanks so much. Send questions our way. Again, info@901pt.com is our email. Clay J at 901pt, that's me. Or you can call us 901-310-3901. This is the 411 with 901. I thought it was going pretty well. Cheers. Now I got